the complications and the risk, with the cold, like I said, there's hardly any complication unless perhaps if you're very, very immunocompromised. One of the complications that I personally have experienced with the cold is you can develop a sinus infection. That's rare, but that's one possibility. With the flu, most people recover within 7 to 10 days. The main complication that you worry about is when it goes to the lungs. You can develop a viral pneumonia, but a viral pneumonia can also progress to a bacterial pneumonia. So the virus damages the lung, and then you can get bacteria on top of it, and then that can actually, the person gets better for a while, and after a few days they get worse, and that they may have developed a bacterial pneumonia. Flu has other more serious complications which are more rare, but they're very well reported. Sinus, ear infection, myocarditis, which is inflammation of the heart, encephalitis, inflammation of the brain, seizures, muscle inflammation, and some neurologic conditions such as Guillain-Barré syndrome, which causes paralysis of the body. And there are certain groups of people that are higher risk of developing these complications with the flu. They're very similar to what I mentioned before. Over the age of 65, diabetes, pregnant, I already mentioned those earlier. As far as COVID-19 major complications, the main one obviously is the viral pneumonia, and because that one where that can not only get you into the hospital, it can actually progress into something called pulmonary fibrosis as well, where the lungs actually start to become scarred, and often when this complication of pneumonia, if you have scarring, it can continue to progress rapidly, and over weeks and weeks, sometimes you just lose the patient. No matter everything you try, the respiratory failure just continues to progress, and eventually the patient dies, and that's the most common way of these people die. Now, you can get other complications such as blood clots. We see that often in these patients, blood clots in the lungs, but you can also get blood clots in the brain. They can actually come in with strokes. And towards when they really get sick and towards when they're close to dying, multiple organs can fail, because of the massive inflammatory response that the body goes through. The kidney can fail, the heart, lungs, and that's when you've pretty much lost hope. There is one thing I want to complication which can happen when people they think that they've recovered. They've recovered, but they haven't really recovered. And this phenomenon is called the post-acute COVID syndrome, or sometimes they call it long COVID. So about 25% of people who have recovered, they think they've recovered, they may have long-term symptoms for many months, up to a year. Some people who had COVID last year, they're still having symptoms of brain fog. They can't concentrate. They're depressed. Their blood pressure may go up and down. Their heart rate may go up and down. They have constant severe fatigue all the time. The muscle aches, and this can. A lot of people are experiencing this so-called long COVID, and really it's very debilitating. And 12% of people have not even been able to go back to work because of these symptoms.